Talk about the budget, the president's budget in terms of Social Security and how that is going to affect you and your family in order to access your Social Security benefits. So we'll talk about that today. And this is also a live Q&A. Looks like I already got a bunch of questions. Somebody looks like they were medically denied for a disability within 15 days. That doesn't sound right. That sounds like a technical denial versus a medical denial. But let's go ahead and talk about the budget and how it's going to affect you first, and then we'll get into all the questions. So let's jump in there and we'll get through this as quickly as possible so we can help you out with all things retirement, survivor benefits, disability, Medicare, Medicaid, and all the rest of it. Okay. So this is what's called the skinny budget. This is the president's budget going forward, and this particular category. So I'll swipe down the rest of the page and show you all the other categories. But we want to focus on Social Security here. So the budget supports the president's promise to not touch Social Security benefits. If you're new to my channel, you know that's good, but it's also bad because the Social Security needs to be touched. Why? Because we've known about this for decades and we keep kicking the can down the road. We and our politicians refuse to fix this, but we are going to get a cuts across the board. Everybody is going to get cuts across the board if we don't touch Social Security. If we don't fix it, then by about 2034, 2033, it's going to be a little bit earlier. You're going to get about 21, 22% cut, everybody. So that is a reality. You can look at the my YouTube channel. I have in the description the Social Security trustees report about this. I have the Congressional Budget Office. This is completely acknowledged. We've known about it for decades, but now is our time to fix it. This is the last time to fix it. And if the president doesn't touch it, then it's not going to get fixed. So it's good in the sense of he's not going to reduce benefits. He's not going to raise the retirement age, but that's fine. But it's like watching a house burn down. Well, I'm not going to do anything to put it out. I'm not going to touch it. I'm just going to let it burn down. That's essentially what's happening. And it's not this president, it's the previous president, the previous president, the previous president. We've known about this for decades. And unfortunately, we're just kicking the can down the road and there's no more road. Okay. So it also includes, I'm continuing here, it also includes sufficient resources for the Social Security Administration to improve customer service. Okay, we all need better customer service. 3-hour wait times. It's taken months and months and months to get your disability claim approved, also to get your survivor claim approved, retirement claim approved. People are losing their health insurance and they can't get Medicare because they can't get customer service. But what is the solution to improve customer service? By expanding online services. Okay, so under certain circumstances, online services, if you're looking at a new claim for retirement benefits and you've checked your earnings record and you know everything is good and you're filing for the right benefits, you know you're not supposed to file for spouse benefits or disability benefits or survivor benefits or independently entitled divorce spouse benefits or whatever the case may be, you're filing for the right benefit at the right time, you're doing everything correctly, then online do it yourself. But the problem is, regular viewers to my channel know that there's exceptions to the exceptions, and there's so many people that come in here on a daily basis and they say, well, I wish I would have known that last year. I wish I would have known that 5 years ago, because they made the wrong decision. And making this a DIY, do it yourself filing for disability or retirement or anything like that, we're going to see a lot of people. Remember, you paid for this customer service. Those decades that you paid into FICA taxes, those FICA taxes for Social Security and Medicare went to, fund your retirement or survivor benefits or disability, whatever the case may be. But also a very small percentage of that also went into paying for customer service. So when you turned 62 or 67 or 70 and wanted to file for your benefits, someone at the Social Security Administration was there to answer your call, set up an appointment, walk you through the entire system, and make sure you got the right check at the right time. But unfortunately, you're left to your own devices. And if you get the right check at the right time, then more power to you, I guess. But if not, they're not going to be there to help you out. And the budget, this is the actual budget here. So last year was 12.7 billion. This year, going forward, 12.7 billion. So inflation increased prices of buildings, all the thousand or so buildings throughout the country that have district offices. All of that increases every year. So when you keep the budget flat one year over the previous, then that's essentially a budget cut. So they're actually, in effect, cutting the budget even more for Social Security. So it's going to be even harder to get your benefits in the future. And yeah, I'm not exactly sure how they're going to reduce wait times and over the phone. One of their solutions is the budget also includes investments to program integrity, but there's no increased budget to do that. So I'm not exactly sure, where that's going to come from. And they're talking about artificial intelligence, investments in artificial intelligence. Yeah. Not sure where that's going to help, whether you're going to have to call in and talk to a computer to get your retirement benefits, and who is going to design the artificial intelligence. I'm not sure if you know, but Elon Musk, they have their own artificial intelligence. It's what it's called, Grok. So maybe they're going to tie their artificial intelligence into the Social Security Administration. So if you want your benefits, you're going to have to contact Elon Musk and Grok artificial intelligence. We don't know. I'm not exactly sure what this means here. So all of these efforts, artificial intelligence, keeping the budget the same, the efforts would help ensure that Social Security delivers timely and accurate Social Security services to the public. I'm not really seeing where that is coming from personally. But I do see in the budget, you can look in the budget. I'll put these in the YouTube description. But in the budget, there was a $1 billion increase in the budget for, guess what? So we can go to Mars. So if you ever see Elon Musk, he always wears that T-shirt that says, "Occupy Mars." So I guess he's going to get $1 billion to occupy Mars. But in terms of getting your retirement, your disability, your survivor benefits, not so much. So we need to occupy Social Security benefits and Social Security offices to make sure you get your benefits. All right. So if you disagree with that budget, so this is the presidential budget. It goes to Congress. Congress has to look at their budget, and then they do the negotiations. But during that time, if you agree with what the proposal is for the Social Security Administration, call your politicians and say, "Yep, I completely agree that." The president's budget is correct. If you don't, then do the same thing. Contact your politicians and say, no, customer service, waiting 3 hours, waiting weeks and weeks and weeks to get my retirement claim or disability claim, or months and months and months to get your disability claim approved is completely unsatisfactory. You paid for that service and you're not getting it. So, okay, let's get into some questions here. Ed, another Ed there. Did you see Secretary Bessent's press conference last week where he said some of the tariff revenue may fund the Social Security tax reduction? So basically, tariffs, you pay tariffs. It's, the company pays it, the country, whatever, if you're importing stuff from China, China isn't paying for it. The importer in the United States pays for it, and then they pass the price on to you, the increase on to you. So basically, and so I think, so this is going to turn this over to poor people, essentially. Low income people are now going to have to pay for these tax cuts for people that are not low income, because what's happening is they're talking about no taxation on Social Security benefits, which I agree with, by the way. A lot of viewers here believe that Social Security should have never been taxed. Your Social Security benefits should never have been taxed, but they have been, and it generates about $60 billion every year that goes into the Social Security Trust Fund. 40 or 50% of low income of Americans retire on Social Security benefits don't pay that. It's those people that receive Social Security benefits and have other types of income, other pensions or income or 401ks or whatever the case may be, they pay taxes on their Social Security benefits. 40 or 50% of lower income people do not. So When you do the tariffs, then basically the money that you go into Target or Walmart and pay that extra money, I guess that's going to go into it. So basically, the low income people are, guess what? Going to have to pay for it. Going to get screwed again. So I think that's a terrible idea. I mean, if you just look look at it on the face of it, doesn't sound like it's a great idea. Hello from Louisiana. My question is, since I have been on my mother's Social Security since 2020 disability, and now I am 66, could I be eligible for my mother's retirement Social Security? Okay. Someone else pointed out that, Be Nice said that would be a new one for me, David. Never heard of that without being a DAC. So good catch there, Be Nice. But he could just very well be a DAC. It has happened before. So a DAC, a disabled adult child, you can get benefits off of your parents' record if you prove to Social Security that you became disabled before the age of 22. So David, might have been proven disabled before the age of 22, even when he was 50 years old or 60 years old. So this could very well happen. So let's say yes, you are receiving benefits on your mother's Social Security. And when you turn 66, could you be eligible for mother's retirement? So you already are. If you are a DAC, a disabled adult child benefits, you are already receiving benefits from your mother, whether it's retirement benefits or disability benefits or whatever the case may be. And then if something happens to her, then your benefits will automatically switch to survivor benefits. So right now you're receiving 50% of your mother's full benefit amount. If something happens to her, you will switch to 75% of those benefits. And that's completely automatic. You don't have to do anything. So let's see, get some other questions here. Where was that one question? Let's see. Oh, already answered that one. For earnings, someone, I don't see this question, but I'll go ahead and answer it. Someone filed an initial claim, a disability claim. They were denied, and then they filed a request for a reconsideration, and they were denied again after about 15 days. That the 15 days on a reconsideration, I don't think I've never heard that being denied that quickly. Either if it's a reconsideration, because when you file for disability, you're denied the first time. It takes months to be denied to get your decision. And if you're denied, you file a reconsideration. And then what happens is they send that up back to the Disability Determination Services, the state agency that makes those medical determinations. And someone else gets assigned that case, and someone else looks at the decision the first time. So that goes through the whole process. So that takes months and months and months and well. So, but to get something immediately denied within 15 days, I am almost certain that is a technical denial that never went up to the DDS because it did not need a medical decision. You were denied. I'm just, based on my hundreds of thousands of times doing this, it sounds like a technical denial. That means you are not insured for disability. You're not insured or currently insured. They're two different things. To be insured for Social Security disability, that means you paid into the system. You paid FICA taxes for X amount of years, usually 10 years or something like that, 40 quarters. To be currently insured for disability, you also have to be currently insured, only for disability. And the example I always give it, let's say you are 60 years old and you want to file for disability. You are insured because, let's say, in your 20s and 30s, you worked and paid into Social Security. So you've got your 10 years, you got your 40 quarters. So you're insured. You're insured for disability. But for the past 20 years, you haven't worked. Therefore, you're not currently insured because Social Security says you had to work 5 out of the last 10 years. So if you did not work any of the 5, it doesn't have to be consecutive, any 5 out of the last 10 years, if you didn't work 5 out of the last 10 years, you're not currently insured, and therefore you will be denied technically. I'm thinking possibly something along those lines because I don't think that's a medical denial. So. But remember, anytime you're denied from Social Security, you do the initial that you file disability or retirement or whatever the case may be. then let me show you my new website that I'm working on right now. Um, Maybe it'll be a little bit easier to see. Um, all right, let me get this question out there. Okay, so the appeals process, you file a new claim, and then if you're denied, you go into what's called the reconsideration. And then if you're denied the reconsideration, then you go see a hearing, which is you go see an administrative law judge. If you're denied by the administrative law judge, then you go to an appeals counsel. You don't have to go to these places. You just submit paperwork to, file the appeals at the appeals council hearing or whatever the case may be. And then if the appeals council, you lose there, then you can go to federal court all the way to the Supreme Court. So there are several steps on the entire process. So, and my website should, hopefully it'll be done later this week. So, all right. So yeah, if you're denied at the reconsideration stage, please, always look to the next stage. If you still think you're disabled, if you think you are due those benefits, definitely. All right. Let's see here. James, what's up, James? I'm at full retirement age and still working full time, and my son is 5 years old. Is he eligible for benefits on my record? And will it lower the benefits I'm already getting? Okay. So you're at your full retirement age, and so work doesn't matter anymore. You can make $1 billion a month, and it doesn't affect your Social Security benefits negatively at all. And your son is 5 years old, so he is eligible for benefits on your record. As soon as you start benefits on your record, that's one of the questions a Social Security employee will ask. They will ask you, do you have any children under the age of 18 or that became disabled before the age of 22? You can tell I've asked that about 1,000,000 times, right? And you say, yes, I have a child under the age of 18. And they say, okay, let's finish your claim and get you all set up. And then we'll go ahead and take a claim for your son. And no, it does not affect your benefits at all. He gets 50% of your full benefit amount, your primary insurance amount, the amount you would receive at your full retirement age. And he'll receive that until he's 18 years old or until he graduates high school, or 19 and 2 months. If your spouse is essentially not working in order to take care of him, she can get what's called auxiliary child in care benefits, AUX child in care. And she can receive essentially up to 50% of your full benefit amount until he turns 16 years old. Unless he's disabled, then it could continue forever. And this is exactly what I'm talking about, is like James there, if he was forced to do everything online because Social Security didn't have any staff, then he would go in there and he would file a claim online and he would get his retirement benefits. And, maybe he would have caught the fact that his child would be eligible for benefits, or maybe not. So that's the problem there, that you really need to speak to a human being. AI is awesome and all that kind of good stuff, but yeah. And also for your son, he will also require a representative payee. So if you want to be the representative payee, the person that's ultimately responsible to make sure those benefits go for his welfare, or you can make his mother the representative payee. It doesn't matter. Wherever he lives, whoever takes care of his daily stuff. All right, I will apply for retirement at 62. My wife will be 47. Doesn't work if we have 2 kids under 16. There we go. I understand they will be considered eligible dependents. Are their applications done separately? You can, they are separate applications, but you can do those at the same time. So when you file for retirement benefits at 62, remember you have to be 62 the entire month. And so at that time, you file for benefits for the 2 children. And because your wife, it doesn't work, she can file for the auxiliary child and care benefits, what I just mentioned. So you can get those child in care benefits. And because in the previous case, there was only one son, so in that case, both would receive 50%. But there's also called a family max. So there's a family max that's involved. So if you have 2 children and your wife receiving benefits, what they will do is they'll look at the maximum that can be paid out on your record, and then they'll divide it by 3. Or if it's the same amount, they'll just give it to the kids. So they'll tell you the numbers at that time when you file. So yeah, conceivably, all three could receive benefits. And you can determine when you do the appointment, they will tell you whether it's advisable to do, benefits for your wife, the child and care benefits. But if there's no more money because of the family max, they might just say, let's just go ahead and give it to the kids, because if we put a third person on there, we'll just have to, reduce their benefit amount. But be careful on that. A lot of people make that decision and they say, well, if the max is already paid out $1,000, $1,000 to the two children, why divide $2,000 by three? Just give them, $1,000 each. And then the ages of the kids are such that when one of the children gets off benefits when they turn 18 years old, the maybe the other one is still under 16 and the other parent could have received benefits, and they often forget about there and they lose benefits, several years of benefits. So it's unfortunate. So he said we are saving billions of dollars in tariffs. Yeah, that's yeah. The only way you save billions of dollars of tariffs is by not having tariffs, because tariffs are paid by us. Anytime you go shopping, we pay tariffs. So there's no way, there's no way to save money on tariffs unless you just don't have them. So I believe that no tax on Social Security for certain income levels would need to be approved by Congress. Yes, 100%. And there's actually a few. They've done a bill in Congress for decades, and it's never gone anywhere. So there's a couple of 3 bills in Congress right now that says no tax on Social Security benefits. Yes, and it would need to go through Congress. That can't be done by an executive order. So, all right, let's see. We got Benita. I tried to file, however, because when I filed for my husband and used my email address, it isn't letting me do it. Do I just need another email address for mine? Yeah, Benita, it sounds like you're just having issues getting into my Social Security and all that kind of stuff. And it's difficult to get into mysocialsecurity.gov and set up an account and stuff like that, but it's a good thing. That way, you have to go through a bunch of, jump over a bunch of hoops to get your account set up. But that is a good thing because it makes it 100 times more difficult for someone else to go in there and pretend to be you. So yeah, you just have to keep trying. And if you're not able to get in there, you just call the 800 number. And remember, Benita, if you've been trying to file for benefits, retirement benefits, spouse benefits, surviving spouse benefits, anything, whatever the case may be, and you've been trying to get into the system for, a couple weeks or so, because this is the first part of May, and let's say you've been trying to do this since April, when you actually talk to someone in the future, tell them that. Says, hey, if they say, okay, you're entitled to benefits starting in May, and you ask, well, could I have started my benefits in April when I first tried to get in there, but I couldn't get in there, or I called Social Security and they didn't pick up the phone, and they say, oh, you tried to call us in April? Oh, okay. So it's called a protective filing. So they'll take you back to April and start your money in April. So don't forget that. That's another thing that, if you just go online, you're losing money if they do everything, AI and all that stuff. So I'm 65 on SSDI. Am I also eligible for my ex-husband's benefits? We were married for 10 years. Yes, if you were, if he's still out there alive and kicking, you were eligible potentially for benefits on his record at 62 years old. But this might be one of those things where it's like you've lost 3 years of benefits because you didn't know it. One of the reasons a lot of people on SSDI, Social Security Disability Insurance, lose those benefits, like maybe you, is that you think that because you're on disability, you can't get any other benefits, which is 100% incorrect. If you're on disability and you're eligible for survivor benefits, you can start those survivor benefits at 60 years old. If you're eligible for spouse benefits, you can start those benefits at 62 years old. If the numbers have to be correct. So for spouse benefits, living spouse benefits, your benefits have to be less than half of your spouses. So I would definitely call up Social Security and say, "Hey, I was married 10 years. It doesn't matter whether they have filed for benefits yet. As long as you've been divorced for 2 years, you're good." Call them up, give them that person's information, just tell them, their name, their age, where they were born, and the Social Security employee will be able to find their Social Security number, and they will tell you whether there's any more money there. And if there is, they will schedule you an appointment. And if there's protective filing thing, if you've been trying to do this for a while, you called Social Security last year and they told you something incorrect, then once you actually talk to a human being this time and you start talking about, oh yeah, you're eligible for an extra, two or three or four or five, $600 a month, tell them that, hey, I called you guys 6 months ago. I called you all a year ago and y'all told me no and yada, yada, yada. I want my back pay. If y'all would have told me the right thing, or, back in January 2024, I would have filed then. So I want my benefits to start at that time. So let's see. Something to know asks, I applied for Social Security at full retirement age last month. In a week, I had a not on my Social Security account that it was approved, a note. Okay. I asked for it start May. When would be the first payment start, and should I worry? No. So the first payment will start in June. You'll get your first check in June. So if you start your benefits in May, then the May check comes in June. So if you look into your Social Security account and it said it's been approved and done and all that kind of stuff, shouldn't have it worry. As long as you put your right the bank routing number and everything in there, it should be good. And you'll get paid based on if your regular retirement benefits, it looks like, then you're going to get paid based on your day of birth. So if you were born in the first 10 days of the month, you're going to get your check in the second Wednesday of June. Second 10 days of the month, you get it on the third Wednesday. If you were born at the end of the month, you'll get it on the fourth Wednesday of June. So, all right, let's see. Somebody was married 8.5 years, married, husband died 62 years old. Do I get anything? Unfortunately, no. But you said you were married 8.5 years. Were you divorced at 8.5 years, or were you still married to this person when he passed? If you were married to a person, all you have to do is the 9 months. That's what that's like. There's probably tens of thousands of people out there that are missing benefits because they hear this 10-year rule and they say, well, I married someone. I was married to them for about a year or so, and they passed away. So I wasn't married for 10 years, and therefore I can't get the money. 100% incorrect. If you were married to the person when they passed away, you just had to be married 9 months. And sometimes there's exceptions there. If it was an accident, or if it was the person was active duty in the military. So there's so many people out there walking around that, yeah, can get more money, that they're eligible for more money, that they need the more money, but yeah, they just don't. So please press subscribe and like and all that kind of good stuff. So Joanne, hi Ed, I finally got my letter in the mail yesterday. As of May 1st, I am no longer on SSDI. I am on SSA. Thank you. And I do have Medicare and Medicaid. Okay. So yes, I think Joanna was asking about this. I think Joanna was asking about this, yesterday, 3 days ago, that what happens is when you're on SSDI, Social Security Disability Insurance, when you hit your full retirement age, your disability essentially stops. They stop taking money out of your Social Security Disability Trust Fund, and they start taking out of the Retirement Trust Fund. The check stays the same. Most people don't even know the switch. But Joanne, no more medical CDRs, no more work CDRs, no more work limitations. You're completely free. You can go do whatever you want. Yep. And then you have Medicare and Medicaid. Make sure you check to make sure you're in the best plan. Reach out to the sponsor of this live Q&A chapter, and they can see if there's anything better for you out there, or call them up and say, hey, put me on the list for October for the 2026 plans. And they'll put you on the list and contact you once the new plans come out, October 1st for 2026. There's going to be a lot of changes for 2026. It's going to be, yeah. Dr. Oz. Let's see. All right. If you start survivor benefits at age 60, will it be reduced? Yes, 100%. It will be reduced. Anytime you take benefits early from Social Security, spouse benefits, surviving spouse benefits, retirement benefits, they're reduced. Disability benefits, no. The disability benefits are not reduced. So, yes, and they are reduced as if you continue to receive that check, they'll always be reduced. So, let me see. Debbie, what's up, Debbie? I am going to be 65 in July. Currently, I have TRICARE from my retired husband. Do I still need Medicare? Yes. TRICARE, I would reach out to them and double check because it's their call. But TRICARE requires you to sign up for Part A and Part B. But don't do anything else. There's a lot of Medicare insurance people out there, companies that want to try to sell you a Medicare Advantage and supplement plan. You don't need it. Yeah, you have TRICARE. That's good. You definitely don't need a Medicare supplement because that's going to cost you money. If you want a Medicare Advantage, no, you're good. You're good. Some people do it because they want the extra, gym membership or something. But it's yeah, you're good. Let's see. Gail, people can't handle cuts right now. With groceries so high, people are skimping on food as it is because their Social Security check goes to rent and utilities. Food is what's left over, and that's split with gas. Yeah, the tariffs are essentially a tax on poor people. I mean, a lot of the stuff you get at local, big box stores come from China. And when there's a 145% increase in the price, then it's going to hurt the people. Yeah. If you're rich, everything you buy comes from, Italian cars and, Gucci and Louis Vuitton and stuff like that. So I guess might not have to pay a tariff on that, but yeah, they don't care anyway. So yeah, tariffs is really going to hurt the regular people out there. And Gail, so on my YouTube description, I've got a link to the video I've done. It's called Living on Social Security Alone. So click on that little link and watch the video. I've got about 50 different programs out there that might make your life a little bit easier. So grab yourself a pen and a piece of paper, watch the video, and see if there's anything that that will help you out. So how do you get help to figure out Medicare? A, B, C, D, E, F, G, et cetera to Z. Yeah, that's um, so for Medicare, there's Medicare Part A covers the hospital, Part B covers the doctors, Part C, which I hate it being called Part C, is Medicare Advantage. Those are the private plans. Part D is the prescription drug plans, and then there's Medicare supplement plans, which have 10 different other numbers, plan F and G and N. And yeah, so it's crazy. So how do you do it? You find someone you know and trust. If you have somebody in your family that's, your cousin or, uncle or whoever that helps people with Medicare insurance, always use, relatives if you trust them. It always makes everything go better at Thanksgiving when, you do that. But if not, you reach out to my partners at Chapter and they can help you out. They can walk you through, tell you the differences and, tell you that always, anytime you talk to anybody, if you talk to your niece or your nephew about Medicare or anything like that, or you talk to anybody you talk to, when you're up for Medicare, always say, okay, I'm going to be starting my Medicare soon. Tell me about Medicare supplements, Medigap. Tell me about those first, because a lot of people out there, a lot of these insurance agents, they skip that because they make more money enrolling you in a Medicare Advantage plan. There is a major lawsuits against a lot of these Medicare insurance companies out there because they were steering people to Medicare Advantage because it benefited the companies and not the people. Because everybody makes more money on Medicare Advantage plans. So anytime you talk to anybody, always tell them, okay, don't tell me anything until you tell me what a Medicare supplement plan is. What's the difference between an N and a G? And then once you get all that, then you say, okay, now tell me what a Medicare Advantage plan is and tell me what the difference is between a Medicare supplement and a Medicare Advantage. And then you make your decision. So there's no right answer. It's 100% yours. So Ed, we are losing money from tariffs. So what money? Yeah. Again, it's basically a tax. It's a tax on us, the tax on the consumers. So you pay the increased prices. Precious Butterfly, hi, first time here in your live. Hey, welcome, Precious. So remember, this is a community. We've got an awesome community here. We've probably found hundreds of millions of dollars of benefits for people. Um, People watch these videos, and they look at their own particular situation. Now, once they know they're good in their own particular situation, then you start thinking about other people, a little old lady down the street, someone at the church, someone at the local restaurant, or you start looking out for other people. So welcome, welcome, welcome. Gail, people can't. Okay, yes. Let's see. Have you heard about the proposal for a flat rate payment of 1660? Um, yeah, the flat rate payment. There are a lot of different, changing the pricing or changing the benefit amount of Social Security, making the minimum. There's was it the Social Security? There's a bill in there now by Representative Larson. That increases benefits by $200 a month. And yeah, any of those, if you support them, reach out to your politicians. There's always good bills in Congress that's supported by some politician, and there's a lot of garbage in there as well. So if you see a particular one, we need to get behind it. Yes. Brian, how can Social Security take my check saying that I had an overpayment in 2017 and I didn't collect benefits between 2012 and 2018? Isn't that stealing, taking money that wasn't paid to me? Yeah, if they make a mistake, it sounds like they made an accounting mistake, which it does happen. So 100%, you got that letter that's saying you owe X amount of money, then file a reconsideration. It's an SSA 561, file a reconsideration, and that will, someone else in that office will have to look at that overpayment again and double check it. And then they'll send you a letter that says, okay, we double checked it and here's what we found. And if you disagree with it, then you file another appeal, the SSA 501, which is a request to see an administrative law judge. And all of this, yes, unfortunately, it takes forever because Social Security is so short-staffed. But if they are taking money now, because of that, you can ask them to stop it until your appeals process goes through. Or at the very least, you can file a waiver and ask for a lesser amount to be taken out. So you can say, hey, okay, I owe $5,000 and, let's put it a 60-month. I'll pay it back over 60 months while I'm waiting for my appeals if they're not willing to stop it completely. Or if you can't afford the 60 months, then you'll have to provide financial records. And then you can say, well, hey, look at my financial records. I can't, I can afford maybe $10 a month, and they'll do it at $10 a month. And then if you go all the way to the administrative law judge a year or 2 years down the line, and the administrative law judge agrees with you, whatever money you paid back during that time, they will return to you. If the judge says, oh, yeah, this overpayment was wrong from day one, should never had to pay it, then they'll pay all that money back. So let's see what this is. The Shiloh Hendrick story is crazy. She called a 5-year-old, actually his father, on public radio. Okay, I'm not sure what all that is. Ridiculous. When are people going to realize as a consumer we pay tariffs? Yeah, I'm not sure. Do you stop drinking the Kool-Aid people? Right or left tariffs are poison to your pocketbook? No one. Yeah, Smoot-Hawley tariffs going back. Yeah, we found that. It's called the Great Depression. So, yeah, yeah. It's obvious you are disgruntled. Your negative slant is not helpful, and you don't know what you're talking about. Okay. Yeah, I am disgruntled. Yes. We and politicians well, we've demanded politicians take care of the Social Security Trust Fund so we don't get our benefits cut in the future. So yeah, if you're not disgruntled, then I guess you're not receiving a Social Security check, so you don't care. You don't need your Social Security check. But there are millions of people out there that need their Social Security and they can't afford a 20% plus cut in their Social Security benefits. So yeah, we need to be disgruntled. So thank you then for noticing. Any future money from tariffs most likely will go into the defense budget. Yeah, not sure. Dr. Ed, catching up on taxes. That's our favorite thing in the world, isn't it? Doing 22, 23, and 24, if income was way down due to COVID and my Social Security be lower when I decide to take it. Thank you. Yeah, well, it really depends. Social Security determines your benefit amount by your high 35 years of earnings. So it depends if you've got high earnings in the other 35 and your last 3 or 4 not no big deal, then it won't affect it. But yeah, if it Social Security determines your benefit amount by your high 35 years of earnings. So story time with Vinny. I like that. I'm 62, have been getting SSDI and survivor benefits since I was 58. Okay, so if you are getting SSDI and survivor benefits, what you're getting is called disabled widows benefits. So between the age of 50 and 59, you can get disability benefits based on your deceased spouse's record, disabled widows benefits. Okay. All right. If I work, will I still get my survivor benefits? And what is the most income I can make without losing my SSDI? Okay. We got 2 questions there. So in terms of, yeah, since you're receiving 2 different types of benefit. Well, you're actually receiving disabled widows benefits. You're not receiving if your survivor benefits started at 60, then you would be getting 2 types of benefits. But right now you're just getting disabled widows benefits. So essentially disability. So the disability numbers apply in your particular case. So remember, in terms of disability benefits, you can work. It's called the trial work period. And let me pop up. So that's my website that hopefully is completely done this week. So when you're receiving Social Security disability insurance, which you are based on widow's benefits, for those I'm doing TikTok and other things. Sorry, you don't see what the screen I'm showing up. Come to YouTube. All right, TikTok is going to ban me for saying that, but oh well. All right. So when you're receiving disability benefits, you have what's called the trial work period. So for 9 months, you can work as much as you want, and it doesn't have to be consecutive. You can work a month and make $1 billion, take off a month, work another month and make $1 billion. You can do that for 9 months, and it doesn't affect your Social Security benefits at all. After that time, you move into what's called the extended period of eligibility, where if your benefits go over the substantial gainful activity, which is what this year $1,620, then they stop benefits for that month. And then I've also got I've got this in the wrong place, but work incentives. So it goes into a lot of detail on work incentives on working on disability. So yeah, you're able to work, but you have to keep within the parameters of Social Security, because Social Security, Congress has determined that this is not Social Security, just Social Security administers it. Congress has determined that when you're on disability, everybody wants you to go back to work. You want to go back to work most times. And because you can make more money going back to work and you contribute to society and you pay taxes and you don't collect disability benefits anymore. So it's good for everybody. So that's why they put in all these work incentives to allow you to try to see if you can go back to work. And if you try and you're not able to, then no harm, no foul. So Judy, ex-husband passed away at 46. How could he have amassed a PI that will allow me to receive survivor benefits? Yeah, I mean, 46, he could have worked a lot. So, Nona, what will the new channel be called? The top pages of the is covered by chapter info. Okay. Sorry. Let me take this thingy off here. Sorry about that. Thanks for letting me know. Did you notice this is live? It just, it does. Okay, wait, it does still pop up. Okay, there we go. It's just, yeah, it's MyGov Expert. So it's MyGov Expert. It's just my regular. If you go into mygovexpert.com now, you'll just see my old website. This is the new one that's coming up here, and it goes into retirement, disability survivors, Medicare. And then in the future, I'm going to go more details on living overseas and overpayments and living on Social Security alone. So, and then it breaks it down into, like, in terms of retirement, eligibility, working and getting benefits. It goes into all the details and frequently asked questions. So I've got a bunch of little tweaks I need to make, but hopefully it will be done. As someone said yesterday, Ed, a website is never done. So I think they're 100% right. So, Sherry, thank you for the support. $2 super chat. Thank you very much. I appreciate it. My son and I appreciate it. Yeah, it's cost us a lot of money to put that website together, but we think it'll help people out. All automatic deposit changes now need to be done via the Social Security online portal. Yeah, so that was a change 47. They said you have to do this, and then you got to do that, and then they changed it and said you can do this, and then yeah, so it's back and forth, back and forth, back and forth. But yeah, I think as of May 4th, 3:46 p.m. West Coast time, right now, to do direct deposit change, you have to go online, or you can go down to the local office. So you can go down to the local office. So, all right, let's see. Another question here. My sister is 67. Should she retire now or wait till 70? Take it when she can. That is 100% her decision. My new website has a little thing you can do in there. It does a cost benefit analysis, how much you'll lose or gain or whatever the case may be over that time period. But if she gets it at her full retirement age, then she gets her full benefit amount. If she waits till 70, then she'll get probably an extra 24%. If her full retirement age is 67, she gets an extra 8% per year for every year she waits past her full retirement age. So if she starts at 70, she'll get an extra 24%. So, but it really depends on her particular situation. Does she need the money? How's her health, genes? Does she have any kids or any spouses that are waiting for benefits on her record? Yes. So let's see here. I filed an appeal. How long do they take? Wow. Yeah. If you're talking about a disability type of appeal, a reconsideration takes about 6 to 9 months. An appeal in terms of the administrative law judge, they're backlogged for about a year or so. It takes forever. Yeah. Let's see. Unbelievable. These politicians could hurt elders. 20% of 185, you're living in poverty. Are we living in a democratic society? Yeah. So people always call me on this. Participatory democracy sometimes, yeah, with limitations. Yeah, anyway, but yeah, you reach out to your politicians and say, hey, I can't take a cut of 20, 21, 22%. I can't take a cut of 10% on my Social Security benefits, in a few years. So, and again, we've known about this issue for decades, and we just keep kicking the can down the road, and there's no more road. How can Social Security call a COLA increase when Medicare turns around and raises my premiums to the point I'm getting less than I was before the COLA adjustment? There's actually a law, hold harmless, that if the COLA isn't enough to cover the increase of the Medicare Part B premium, then they will allow for that. So, I mean, it's only, a few dollars either way, but, hey, a few dollars is a few dollars. Yeah. And the COLA, that is not the numbers that are calculated are not a political decision year over year. What do I mean by that? What do I mean by that? How the COLA is determined, whether it's 2.5% or it's 8.7%, politicians have no say in what it is in terms of, this year, whether it's going to be 2, 3, 4, 5, 6, 7%. What it is the bean counters, Department of Labor, they look at the statistics and they say, okay, the third quarter of last year, we bought a basket of goods and the basket of goods cost us X amount of money. And then in the third quarter of this year, ending September 30th, they will buy the same basket of goods and they will say, hey, our basket of goods from last year increased by 3.1%. So the COLA will be 3.1%. So, but the political bad part about that, so that's been the fact since the 1970s. It's never been a political, the way it's calculated. But the way it's calculated is political in the sense of when they decided that back in the 1970s, they just used a basket of goods for regular workers, younger type workers. What they should do now is it's called a CPI, Consumer Price Index, and they should make it based on elderly people. Elderly people pay more for healthcare. Healthcare costs have gone up. So that basket of goods should be more focused to what elderly people buy. That's the political thing that they definitely need to change. But until they change that, it's not political in the sense of, whether it's going to be 3.1 or 2.3 or 8.7 or 47.6 or whatever the case may be. So at what age do you get regular Social Security? Patricia Weir. Hey, another Weir. All right, we're not many of us. So the Weir is the anglicized Scottish name of De Vere, which is if you studied British history, it's Edward de Vere is the true Shakespeare. So yeah, that book right there. Anyway, claim to fame. Legend. Anyway, so you can get your regular Social Security benefits and disability benefits at any age. You can get survivor benefits at 60 years old. You can get regular retirement benefits if you're talking about that as early as 62. So, Ron, she has not worked for the past 15 years. Thanks, Ed. I learned a lot from your channel. All right, perfect. Thank you. Robots don't have feelings for humanity. Yes, that is a fact. And when they do, I think that's going to be even more scary, don't you? Can my granddaughter, age 16, create my Social Security account online? She got a part-time job in 20. So can she create her own? Yes, I would 100% recommend she do. I think everybody should start a My Social Security account online, because the reason you do is, in the old days, they used to send out your statement every year that, hey, you paid X amount last year, and we just want to confirm, that's correct. They don't send those letters out anymore, basically. Once you get older, they do. But so here's what I see happening. People work in their 20s and 30s and 40s and 50s, and they don't check their earnings record with Social Security. And then when they go to file for benefits at 62 or 67, they say, hey, I'm missing earnings when I was, 37 years old. It's blank there. And you didn't check it. And now it's almost impossible to prove and find those earnings and get it corrected. So basically you're losing money for the rest of your life. So everybody, I don't care how old you are, tell all your relatives and everybody, hey, tax season is done last month. Wasn't that fun? New people paying taxes. Did you finish the last part of the tax season? What do you mean last part? Getting a refund check or paying my tax? No. The last part is going into mysocialsecurity.gov, checking to make sure Social Security got notified of those earnings and make sure everything is correct. And it doesn't hurt to go in there as well to see if there's anybody else working on your Social Security card, on your Social Security number, which will cause you a lot of problems later. So, Ed, did you answer my question? I was the person now legally blind. Okay. Yeah, I've got tons of questions. I don't think I'm trying to look for your question. I got a whole bunch of them. I think I missed that one. Sorry, but Kimmy, I'm 63 and have had health struggles. Can I collect Social Security and then request Social Security disability? Yes, that is called a RIB-DIB. You can file for retirement benefits and disability benefits at the same time. You don't get both checks. You get basically, the higher if you're approved for disability. Okay. And why would anybody do that? Because disability claims take forever to process. So Kimmy's 63 years old, is not working or working very minimal because of disability. And you start if you go ahead and file for disability benefits, probably it's going to take you months because Social Security is so short-staffed because politicians, anyway, so you're going to take action on that. But anyway, disability is going to take months and months and months to get a decision. And Kimmy just can't, live months and months and wait for months and months and months without money. So what you do is you go ahead and file for retirement benefits and disability at the same time. And that way, while you're waiting for your disability benefits to hopefully be approved, then you can have your monthly retirement check. And then, kind of caution on this, once you're approved for disability later, it depends when they determine your disability started. If they say it started before your retirement benefits, then there's no issue. But if they say your benefits started, 6 months or a year later, and you've already received 6 months or a year of retirement benefits, they're going to reduce your disability benefits a little bit. But yeah, but number one, yes, if you need the money, it's called a rib dib. So when you call Social Security and set up an appointment, and I would do this immediately get that process started. Call them up and say, "Hey, I need an appointment for a rib dib," and they're like, "Okay, this person knows what they're talking about, so we better treat this person right because they've got someone on the inside that they're feeding them information." So, I looked for the Doge FOIA, but it's not a website. Do you know? Yeah, just type in Freedom of Information. It's just a general website. Yeah, you don't look for Doge FOAI. You look just for Freedom of Information Act, and then yeah, you get it through there. And then you just specifically put down there that's what you want. Because some of us on SSI want to work and save money, and we can't. If we had a basic income, we could. Yeah, that's with coming with the AI and robots and stuff like that, it's going to put a lot of people out of work. And so, yeah, a lot of people are talking about it, kind of a basic income. So, what can you share about means testing's earnings that may affect Social Security benefits? Maybe raising the income cap is better for increasing fund balances instead of raising taxes or reducing benefits. Yeah, that is the solution that a lot of us here. Oh, not this one. Let me get where is it? This one. Okay. So what they're talking about, what that person's talking about is the raising the FICA cap on Social Security. If you are paying into Social Security benefits FICA tax, everybody pays the same, the 6.2%, and your employer pays 6.2% into Social Security FICA tax. But after $176,100, you're exempt. No more FICA Social Security tax anymore. So that's the problem. That's one of the major reasons we're going to get cuts in the future, is because a lot of the money that used to come to us is going to, the wealthy, and they are exempt from FICA taxes. So that's the problem. So the idea is to smash that cap that everybody pays FICA taxes on all their income, just like the rest of us schmoes. Because there's no cap on Medicare. If you're making $1 million, then you pay the 1.45% for Medicare on all of that $1 million. But on Social Security part of FICA, you only pay up to $176,000. So if we did that a few years ago, that would have solved 100% of the problems. But because we keep waiting and waiting and waiting, if we did it now, it would solve about 73% of the problem. And we need to find another 27% to fix it. And so, yeah, the means testing benefits is one option. And you can see all of the options. You can see all of the options in my YouTube description, where I've got the Social Security actuary, where he goes through anytime anybody has an idea about how to fix Social Security, the Social Security actuary pulls out their big calculator and they run the numbers. And that's what they did with raising the FICA cap. A few years ago, they ran the numbers and say, yep, if we did that now, then that would solve 100% of the problem, and there would be no cuts in the future, and Social Security would be good for decades and decades and decades. But then he ran the numbers the next year and says, okay, it's going to solve 97% of the problem, and then 92% of the problem. And now, yeah, so we should have fixed this decades ago. But yeah, anyway, they just distract us with, oh, the money was stolen, it was given to illegals, it was given to Ukraine, and yada, yada, yada. Yeah, it's just a distraction. I am 49. I've been getting disability since I was a little girl. My mother passed in 2000. They put me on my dad's account. They said I had Medicare, and I didn't know because I've been on Medicaid. Okay. So yes, you are receiving disabled adult child benefits. That's SSDI, Social Security Disability Insurance. And as such, you're entitled to Medicare after being on that for 2 years. So, sounds like you probably have both. You're what's called dually entitled. You have Medicare and Medicaid. Hopefully, you're getting that Medicare savings program where Medicaid, your state Medicaid, is paying for your Medicare, that $185 Part B premium. Hopefully, they're paying that. And then there's the Medicare Advantage dual eligible plans. Everybody knows I always recommend Medicare supplements, but if you have Medicaid, you can't get a Medicare supplement. But maybe a Medicare Advantage dual eligible plan, that's the one you can get some extra money for, grocery cards, depends where you live. There's a lot of bad, scammy advertising about there. They do exist, but it really depends on what area you live in, transportation, all kinds of other benefits. So you can call chapter, whoever, and see if there's something available in your area. Just call them up and say, hey, I'm dual eligible. Am I in the right thing? So, all right, let's make this the last-ish question. I'm on SSDI, and I could watch a video about living on Social Security alone, and there's no way it would help me because I only get $10.90 a month in SSDI, and my rent is $11.95. I don't know. I've got a lot of things in there that are not only necessarily, if you've got 1099, you got the Medicare Savings Program. You can, yeah, there's a lot of stuff in there that just might help you out. So, I think it's like I've got like several versions. One of the versions of that living on Social Security alone video is like 4 different videos that I did when I first started doing YouTube about a year or so ago, and they suck, so I would stay away from those. But the one I've got linked in my YouTube description, it's about 15 minutes. So it's 15 minutes of your life. So it's completely you decide. All right, let's do one more question of someone I have never seen here before. Susan, all right. I hope we all win the lottery. Yes, I agree. We have to live on net dollars, not the gross amounts that Social Security lists as the amount not to exceed before your full retirement age. Yes, good point. That when you're receiving benefits in early retirement, the $23,400 limit is your gross wages, not not your net wages after taxes, after you contribute to a 401 or anything like that. Yes, it's gross wages. So, all right, that'll be it for today. I appreciate you all. Please look out for each other and have a great night, and we'll